So our next session, we're being joined by Davies, the Managing Director of Habitat, based in Leeds, and Sanah, one of her colleagues, who is the Evidence and Evaluation Lead. So they've got a few slides. Sanah's going to kick off and start talking about some of their work. And are you there, Sanah?
Hi, yes, I'm here.
Right, okay, and I can see you, Ros. So I'm going to hand over to you now, ladies, and thanks very much for being here.
Wonderful, thank you. Hi, everyone. Could you just go to the next slide, please? Fab. So I hope you all had a nice coffee break. I'm Sanah. I'm thrilled to be speaking today. It's been great listening to everyone so far. I work for Habitat as the Evidence and Evaluation Lead, and I'll be speaking today with my colleague Ros Davies, who is the Managing Director at Habitat. Today we're going to be talking about ways of creating change and how our allies and the Shuri network can create conditions where people like me can flourish. And this links perfectly with this quote here by Alice Walker. Look closely at the present you are constructing. It should look like the future you are dreaming. We have the exposure and now we need to do something to make a change. Next slide, please. Thank you. So I'd just like to talk a little bit about what we do at Habitat. We're a co-design, digital inclusion and innovation team hosted by Leeds and York Partnership Foundation Trust. The future we're dreaming of and our vision is to see a world where everyone benefits from digitally enabled health and care, and to co-design digitally enabled health and care that works for everyone. Some of the projects I'm involved in have a real impact, such as Mindwell, which is the mental health platform, co-designed to provide a single place for information about mental health in Leeds. And another project I'm working on at the moment is with NHS X, looking at shining a light on good practices across ICSs. So co-design is all about the people. It's recognizing that people are not the problem, they're in fact the solution makers, and that we own what we create. And it's about facilitating and unleashing the potential of people with lived and learned experience to become powerful together, leading to new relationships of shared understanding, purpose, trust and power. And there are many reasons why all of this is important for a diverse environment. Everyone has a unique set of ideas, talents, experiences, insights and energy to be unleashed. So why would we waste that resource? And inequality costs lives and money, and COVID has really shone a spotlight on this. And when you work in partnership with people, they become champions for change, which is what we're trying to seek. And this is why we believe in co-design. Next slide, please. So I'll just pass it over to Ros.
Hi, everybody. So thank you, Sanah. I feel really privileged to be standing here alongside Sanah today at this really, really important event. And I'm going to talk a little bit about being an ally. I'm not sure if you can see the poster in this picture, in this Black Lives Matters picture. I can't quite see who's holding it, but I'm assuming it's a white ally like me. And it says, it's not just solidarity, it's basic decency. And this poster expresses exactly how I feel about diversity and inclusion, not just in digital health, but in the wider society. And it expresses how I feel about being an ally in the Shuri network. For me and for the whole team at Habitat, diversity in digital health isn't just a good to have or a badge to wear, it's social justice. And social justice, at the end of the day, is just basic common decency. My favourite and overused quote is another Alice Walker. The most common way that people give up their power is by thinking they don't have any. And I know I have white power and privilege. I don't really fully understand what that means, but I have a personal and a professional responsibility to find out, to listen, learn and act. And at Habitat, we know we've got a long way to go, and we took a decision as a team that we would take the time to listen, learn and act to help co-design more diverse and inclusive digitally enabled health and care. And that's sort of become our mantra. So here are 5 principles or actions that I think I have learnt about in terms of building diversity into digital health. The first is hold the door. And this is about when doors of opportunity open for me or for Habitat and our mission, my job is not simply to walk through the door and shut it behind me. It's to stand in the doorway, put my foot there and stop it shutting and beckon other people into it, in through the door. And I don't need to go into the room always to achieve our common ambition. The second is about amplifying. So we use our own resources and profile and network to amplify others and endorse and support them and spread the word and connect them. So, for example, we're hosting a series of events for the Leeds Digital Festival at the moment, and we are highlighting in every single one the good work of Solidaritech and Digital Access West Yorkshire, and we'll be they collect unwanted devices and give them to people who are refugees and asylum seekers and young people. So the third point is challenge. Whether it be in the street or in the workplace, systemic or a specific moment in time, we have a responsibility to stand up and challenge inequality and racism and hold the line on common basic decency. As a leader at Habitat, I've worked alongside the rest of our team and others to pivot our mission to focus more explicitly on equality and equity in digital health. At a system level, we're campaigning for inclusive digital transformation. And for us, this means ensuring all our projects include inclusivity or consider inclusivity. And it means working collaboratively with all the people in our system. So the NHS, NHSX, NHS England, academic health science networks, local government, the third sector and industry to build capacity and co-design enhancements to tools and services and strategies. And the fourth is co-design. And Sanah's already talked about our co-design process. And this isn't just a methodology, it's a way of thinking, part of our culture. So co-design is fundamentally recognising that creating the future isn't a single powerful leader's game. It needs all the stakeholders in the room. And if we're to design out racism and inequality, we need to create the conditions where the power, ideas and talents of new and diverse voices are unleashed, such as Sanah's. And five, the last one, is about becoming more powerful together. So power isn't a zero-sum game. I know that if I do what I can to create the conditions for all the members of my team and the people we work with to feel more powerful and to be able to use their power in common purpose, we will achieve far more than I could on my own or Habitat could on its own. And I did say that was the last one, but I think I've got a new one, and it's the sixth. It's the one that's already been quoted this morning by Shira, where Victor said, I don't know a leader that hasn't, I might get this slightly wrong, so apologies if I do, but I don't know a leader that hasn't had someone put their arm around them and say, I think you're good. And that has happened to me and really helped me. Sanah, I think you're good. So in the spirit of being humble and listening and learning and acting and all of the six actions that I've just talked about, I'd like you to hand you back to Sanah, who as a young, ambitious woman from a British Pakistani background is going to share her experiences, her insights and ideas for how we can create the conditions where she and her peers can flourish. Back to you, Sanah. And could you move to the next slide, please?
Thank you, Ros. So I thought I would use this presentation to share some of my experiences, insights and ideas on how I think we can create a brighter, more diverse future in digital health. So I'm a 24-year-old British Pakistani. I have a background in psychology and a master's in neuroscience. I'm quite new to the NHS, so I started Habitat at the beginning of the year prior to going into lockdown. Over the years, I've unfortunately witnessed a lack of diversity in leadership roles. For example, I've been in rooms of leaders and decision makers where the minority has been those of colour and women. I've been listening to my parents, friends, family members, strangers online talking about the difficulties they faced over the colour of their skin. And more recently, these conversations have increased, and that has left me with feelings of outrage and sadness about the unfair world we live in. And like myself, I think many people have been able to see the deep inequalities and bias that exist across our society, especially in recent months. When I was first asked to do this talk, at first I felt like a bit of a fraud. I do feel as though I am privileged. I was able to study at university, complete a master's, and got my foot in the door in my role at Habitat, all whilst having great role models at home. But my feelings of being a fraud quickly changed when I realised I finally had an opportunity to speak out about the inequality that I and others see when making a change to ensure diversity in a field which I love and aspire to be a leader in. It's clear that there are disparities that impact Black, Asian and minority ethnic communities by simply looking at the stats. So, for example, research from Inclusive Boards found that 8.5% of senior leaders in the industry were from a BAME background, and nearly 75% of boards had no ethnic minority representation. And 20% of the NHS workforce is BAME, and 77% are women, yet there are less than 10 women of colour in senior digital leadership roles across 233 trusts. I'll admit that I was shocked by those figures, but not surprised. And we're in need of a big culture change to address this. Today, I've always worked in a male-dominated environment, yet whilst working at Habitat, I've been lucky to work with some amazing women who have helped me grow and flourish in such a short time, but also acknowledge inequality and the challenges faced in the BAME community. I think that right now we are seeing a lack of support for BAME working females and role models. Although there is exposure to this, we need to work together to develop steps and create a real impact. I think the Shuri Network is most definitely creating a change by allowing women of colour a platform to share experiences, as well as providing future leaders shadowing opportunities, amongst other things. As a young woman aspiring to become a leader, I would like to see more BAME leaders in leadership roles, more opportunities for shadowing and a place for advice and coaching, a welcoming environment addressing uncomfortable conversations, and changes in combating unconscious bias and lack of diversity. I will personally be making an active change to build my support network through platforms such as the Shuri Network and helping other young people get connected. I think we all have a responsibility to make change, inspire confidence and strength, and work with support networks to promote equality and diversity. Next slide, please. And I will leave this here. Thank you for listening.
Thank you so much, Sanah. That is lovely. And thank you, Ros. We have got time for just one question, if I may. We've got a question in from a member of the audience, and she asks, does the inclusion of diverse staff lead to digital inclusion for service users? And what are the key factors in achieving digital inclusion for populations that experience exclusion as a result of discrimination, poverty, those kind of things? So, and Ros, I know you've done a lot of work in this area. Do you want to have a go at that?
Sorry, could you repeat a little bit of that question, please?
Yeah, sorry. So does the inclusion of diverse staff lead to digital inclusion for service users? And what are the key factors in achieving digital inclusion for populations that experience exclusion as a result of discrimination or poverty or...
Okay, so the first question, not necessarily, I don't think, but what it does is open up the conversation. And actually, if you've got, I think it was something else that Victor said yesterday about diversity equals competency. So if you've got diverse voices in the room, then you're going to have much more empathy and understanding and connections and reminders and so on. So you're more likely, I think, to be able to understand and reach out and do the right things which leads towards digital inclusion. So it helps, but it's not the only thing. And I think there's something about power, using your power and privilege together, isn't there? So if we can do that, if we can operate those principles that were talked about earlier around an inclusive, diverse workplace and respect the diversity of opinion, then that then plays out in your policies and in the work that you do. And in terms of sort of ideas of how we ensure we do get more inclusive in digital health, in terms of people using services and so on. It's a really complex picture, and we talk about it as a complex, wicked system issue. And there's three factors that we need to together understand. The first is people's life context, what's happening to them, their physical, mental health conditions, where they're from, and so on. So, if you're suffering from domestic violence and abuse, there's going to be some very complex issues getting in the way of you being able to use digital health tools and services. The second is about digital skills, confidence and capability, and access to devices, which is why we always big up Digital Access West Yorkshire, because we know that poverty, data poverty and digital poverty is a really important issue at the moment. And then the third is the system. And the system, I think this is the often forgotten bit of digital exclusion. And it's about accessibility of tools and services, about user experience, and it's about the confidence and skills and capability of the staff who are, to use digital tools and services themselves, but also to support others. So we have to understand those factors. And then I think the golden rule, and we would say this, we're a co-design organisation. The golden rule is to work in partnership with the people we're talking about. And I don't just mean consultation. What I'm talking about is actually, at its best, sharing power and trust and responsibility and purpose. So there's a few things. Obviously, it's a very complex issue and there's lots more we could say, but I don't know if Sanah, you wanted to add anything.
No, I think you've answered that very well.
Roz is so eloquent. This kind of stuff is incredible. Thank you. And just a final point before I hand over to Richard. Ghazala comments about power, and so perhaps it's about a need to recognise that power will become more equitably shared rather than everybody becoming powerful. It's about the sharing of that and it being so much more equitable. So thank you, guys. We could listen to you on, and that was great. And I'm sure, there's going to be more and more opportunities for lots of good work and positive stuff coming out of Habitat in the future. So watch this space.